And sorry to my viewers for this for coming up late. Okay. Um, Actually, we are going to. I have a special guest this morning, and I mean this morning, this afternoon, this evening, wherever you are watching us all over the world. Thank you for coming up on the show, and I have a very interesting guest, and we are going to be discussing some important things that is championing for. And basically, this time is World Health Mental Day. I mean, we in quote week, and let me say this particular month. My guest is having a special project for that, and that is why we are coming up on the show at this hour, so that he will tell us exactly what the program is all about. Um, my guest is Charles Oguntade. He is the Secretary General, Global Operations for International Association for Psychiatric Nurses. Today, Friday, 9th of October, 2020. Basically, is joining me live and direct from Australia. Thank you for joining us, Mr. Oguntade.
Yeah, thank you.
Now, I just want to read some of the few things that you actually posted on your wall and what your project is all about. Recently, you organized a 60-kilometer walk for mental health research, and then you are asking for support for mental health research in Australia. You said, and I quote, "This October, I will be working to make a difference to lives of people touched by mental illness and suicide. 1 in 5 people experience symptoms of mental illness each year, while in Australia, 8 people will die from suicide every day." That sounds quite not really good as that, and that is why you are coming up with this idea and this project this time. But before we go into exactly the pertinent, I mean the main question that we are going to discuss this time, can you basically in few words tell us exactly what Global Operations for International Association for Psychiatric Nurses is all about, being the Secretary General, so that my viewer will have an idea, a glimpse of what the association is all about?
Well, International Association for Psychiatric Nurses is a charity-led organization that's been in existence now for more than 20 years. We are group of mental health professionals that are quite enthusiastic about things that's got to do with mental health education, mental health research, mental health leadership, mental health promotion, and we do a lot of stuff. But our concentration is how can we improve mental health service in sub-Saharan Africa and Asia. And we've been doing this in a way of promoting mental health service, mental health development, mental health research, leadership in mental health, and a lot of things that we've been doing over the years. And we do this by providing education, by providing we run a lot of forum, webinar, we do a lot of conferences, and we host this all over the world. Like we have an annual conference that we host every year, which we invite a lot of people to, and we've hosted it in many parts of the world for many years now. So, and I've been a secretary for this organization for more than 6 years now, running. And but then saying that this particular event, this project that I joined in is not actually like a primary project of International Association for Psychiatric Nurses, but it was a project of Black Dog Institute of Australia, which they are
Okay.
research
Okay.
institute. They are research institute into mental health.
Okay. Thank you so much. I know there are a lot of information that you wanted to share, but due to time constraints, we might not be able to go into detail. But now that will take me to the first question. Can you tell my viewers and everybody that is watching all over the world exactly what this support for mental health work is all about? What is it all about?
So, like I said, this project itself is a project of a reputable organization in Australia called the Black Dog Institute, and they are research institute, research mainly into mental health service delivery, and they came up with this funding program to help advance some of the work that they do. And what it involves is that we do a walk challenge, and what was specified is like a 20-kilometer walk, 40-kilometer walk, or 60-kilometer walk in a month. And but you can do more than that if you have the capacity or the energy to be able to do it. And while you do that with fund, then you use the opportunity to raise a fund for the institute, and that is what I've embarked upon. And the idea is a lot of incredible people across Australia that are working in solidarity for the Australian living with mental illness.
Thank you, thank you, thank you. Now, I received some of the questions, and they were asking me, was it really actually a real 60-kilometer walks? If he walk.
Well, yes, it is a 60 kilometer, and I tell you, it's quite easy to walk a 60 kilometer in a month anyway, because it's for a whole month. And
Yeah, yeah.
ordinarily, even when I'm not doing a walk challenge, I'll say like I walk more than 60 kilometers in a month. Like if you, and it's
Oh,
easy to do, if you can do like an
no,
average of a 4-kilometer walk in a day, I can tell you that you cover more than 60 kilometers in a month.
mother,
Like
in a
today is
month,
the
okay.
10th of the month, and I've already covered 26 kilometers already. So which means I will be
Really?
going even beyond I'll be going beyond 60 kilometers
Yeah.
at the end of the month. Yeah.
Yeah, really, that's good. That's good. Okay, thank you. Now, another question that is important is the event global or is it only in Australia? If it is global, what are the channels available for people in other parts of the world to join, your project, especially people in Nigeria?
The event, the World Mental Health Day, when Mental Health Month is global, but the event itself is not global. It is a Australian base, but because it
Okay,
will be misleading if I said it is global. But saying that, we
okay,
encourage people from all over the world to support what we are doing. I've had a
okay,
number of people that outside Australia that have donated into the fundraising. So, like the
okay.
work itself is within Australia.
Okay, okay, good, good. Now, before I will take the next question, you are also raising fund for this support my work for mental health. Then you said, and I want to quote some of the few lines that you mentioned, is that I'm fundraising to raise money for life-changing research into treatment and prevention of mental illness, as well as vital support services. Now, why are you raising funds?
Like I said, this fund goes to Black Dog Institute, which Black Dog Institute is a reputable organization. They've engaged in a real life changing research work groundbreaking research into early detection, prevention, and treatment of common mental health disorders. And they've done quite well using digital innovation, working through lived experience, working with people with lived experience, and focusing even more workplace mental health needs. And they've been one of a renowned organization that actually provide evidence-based therapeutic approach on. They provide a training on a therapeutic approach. All their training, all their services, you get it for free. But they put in so much
Okay,
into
good.
this to make it work. So, and more
Interesting.
reason why it is important to raise this fund for them to continue to do this work that they do.
Okay, thank you. I think that is quite interesting. And then with what you have said so far, I believe our viewers must have really understand what this project is all about, which is quite something that everybody should be able to key in because it's for the support for people with symptoms of mental illness. Now, there is one other question that bothers some people, and they really want to know about this fund thing. Is the fund going into your private account, or there is an organization that is responsible for that? Kindly explain to my viewers so that they will really have at least a full what do you call it idea of what is really happening about fundraising that you are doing.
Yeah, thank you so much for the question. No, the fund doesn't come into my account, and so
Thank
they've
you.
got a link where you donate the money into, so you can donate online. You can donate via different means. You can use your credit card, which is very safe, is secured, and
Good.
you can donate through PayPal,
Okay.
and the money goes straight to them.
Okay.
And they are very, very accountable.
Okay.
If you go on their website, everybody can see how much that have been raised so far by individuals, by groups,
So far.
and the total money
Okay.
that has been raised
Okay.
so far for this project.
Okay, thank you, thank you. So, my viewers, you can hear directly from the horse's mouth. Even if you are paying online, your account is secured. You are using a credit card, Visa, or whichever is secure. There is no problem. Or you are using a PayPal. Your everything is secured, so you should not be worried about that. And you can also hear directly now that the money is not even touching any cent from the money. So meaning that the organization that will be in charge of the research are the one receiving the fund. Thank you for that beautiful information. Now, when let's now assume that the whole money has been received and you met your target even beyond what you are even expecting. What do you have here? How do you now want to use the fund for this research purpose that we are talking about? Then how are you as an individual be involved in this the research process that we are talking about?
Uh, well, that's a good question. The purpose is to help this institute to expand the research work into new challenges and opportunities in the mental health, like suicide prevention, digital innovation, lived experience, youth and workplace mental health. Personally, I don't work for them. Although they do ask for support from individuals. It could be like submitting a paper link to whatever they're doing, which I'm happy to be part of it. But because we believe and we trust in what they do, so I think the best we think many people that are involved in this challenge, the best we think that we can do is to support the good work that they're doing by promoting the activities, making it fun, and raising a fund into improving on the work they do.
Thank you for that. Thank you so much. Now, before we go to before we end this show, I have just the last question, which is now for those people that are interested in this project, if wherever they are watching now, right now, and they actually wish to participate in donating, um, can you just tell us exactly how we can go about that?
So it's very easy. Thank you so much. So the website is www.onefootforward.org.au/fundraiser. If you want to support my individual one, you can do /fundraisers/Charles Oguntade, and that will take you directly to my page, and then you can donate to support my individual effort. But you don't have to pay into my individual effort. You can just do www.onefootforward.org.au/fundraisers, and that will take you to the page, and you can donate into it.
Thank you. Thank you. So it is as simple as that, just as everybody can use the WhatsApp, the Facebook, tweeting, or surfing around the internet. So you just go online, then it's very easy. It's just within a click. Now, before we end the show, my guest, do you have anything that you want to say before we end the show right now?
Yeah. I would just like to say, anyone could be done with a mental illness, just as simply put.
Yes.
So my advice and
Yeah.
my request is that be kinder to one another. Ask your friend, your family,
Yeah.
your colleague at work,
Yeah.
and your neighbors a very simple question: are you okay today? And that might be a
Oh.
life changer.
Wow. Thank you, thank you, thank you. I'm actually asking my neighbor now, are you okay today? And this is where we're going to
Yeah.
end our show for today. And I would like to appreciate my guest for coming up on the show. I know he has a very tight schedule, but we had some technical challenges earlier. But at the end of the day, we were able to have the show. Thank you very much, Mr. Oguntade, for coming up on the show. And I hope next time you're still gonna come on the show, because there is another important thing that I am working upon, which is the COVID and mental illness. And I know recently you took part in an event that was organized by, I don't know if I'm not mistaken, whether it was KB State or
Yep.
Borno State, but I know a
Yeah. It's
particular state
KBC.
in the north. Yeah. So now we actually try. We will actually come up very soon. I will send the invitation to you, so that we have something with the current thing that is happening, the COVID-19 and the mental illness as well. So thank you so much for coming up on the show. I would like to appreciate your time. And to my viewers and my all over the world, thank you for coming up. And don't forget that this particular event, you can still watch it later on the YouTube channel. We will access it as later in the day, or anytime you want. And thank you. Don't forget, as my guest has rightly said, are you
Yeah.
okay
Thank
today?
you.
God bless
Yeah.
you, and goodbye.
Thank you. Yeah. Bye. Bye, everyone. Thank you.